This is Dr. Roger Knapp, pediatrician. Now let's talk about head injuries. And I'm just going to go briefly over some of this. It's not an extensive talking about it. And pretty much you have to fall from at least 4 foot or higher to cause internal damage. So when your child's toddler's walking around, 1-year-old, he falls and trips and hits his head, it's not going to cause brain damage. Now there's 4 misconceptions though about treating and evaluating the head injury. One is that you should hold pressure on it. Have you ever seen the kids get a goose egg? Boy, that thing pumps up fast and gets all sometimes a little black and blue because the blow breaks an artery or vein and it's actually bleeding below the scalp. Now if you cut your leg and you're bleeding, do you put ice on it? No. You hold pressure to clot the artery or vein to stop the bleeding. So really you should not put ice on the head when they bang their head. You hold pressure for a minute or 2. How many times you and I have bumped our head and you pressed on it and it made it feel better? So you'll make the child feel better. They're upset and crying because they don't understand what you're doing. But then you end up with a little tiny bump and not this huge goose egg. You want to stop that bleeding. But ice is not going to help. It's not going to stop the bleeding. You certainly don't put ice on your leg when you cut your leg and you're bleeding. You hold pressure. The second thing is it's okay to let them go to sleep. In the old days they wanted to keep them awake all night. But the question is, are they going to sleep or in a coma? If they're going to go into a coma, you're not going to keep them awake. But what we do is it's okay to let them go to sleep for a nap at night, but what we do is wake them up every hour or so to make sure you can wake them up and drowse them up and they're not unconscious and you can't wake them up. The third thing is they will cry and throw up one time. And that's common when they cry and hit their head. But what you're looking for is throwing up 3, 4, 5, almost like the dry heaves. So if they throw up one time, that's all right. That's not a sign of serious head troubles. And the 4th misconception is the pupils. Now the pupils, everybody will say, well, watch out for those pupils. But the pupils will not change until the child's into a comatose state, and that's really for the doctor to use in the emergency rooms. When your child has increased pressure in the head from a blow, first they'll get, probably the best description is drunk. Slurring your words, staggering drunk. They're just... And then they go into a coma where you can't wake them up. And then their pupils change. That's really further down the road. That's really for the physician to use. And so you don't have to watch the pupils. So we want to see the child and evaluate them if they're drunk acting and throwing up more than one time. And that's your best things to watch for. You don't have to watch the pupils. Thank you. This is Dr. Roger Knapp.